I'd like to have your permission to use this video for educational purpose on the internet.
Yeah.
Now, we had about 9-10 months ago what we call a transcambing OLLIF. Practically here, this is what we did. We took the bottom disc out and put the spacer and screws in. Bone is growing in the front, in the back still working on that. But you are not my best results, and we are going to talk about the specific risk associated with this kind of surgery. You want to tell me, first of all, what were your symptoms before the surgery? Let's start with that.
Well, before the surgery, I couldn't bend my back. I actually was laying down, and all of a sudden it just locked up on me.
How long were you? How did you have those symptoms before the surgery?
Before the surgery, my back had been hurting for years.
Years.
I used to work. Well, I field tested ATVs and snowboards.
Oh yeah. Field
So,
tested. Yeah, I can
The
imagine.
pounding on my back and everything took its toll. And
So the pain, what number would you give it, the pain?
I've
before
been a
the surgery?
constant 6 to 8. Just,
6 to 8.
Just got used to it all the time.
Did you have symptoms in your legs as well?
No,
It was mostly in the
it was
back?
just my back.
Did you have any pain, numbness, tingling in the legs sometimes?
Once in a while, but it
Once in a
wasn't,
while.
wasn't
So,
the whole
not too
deal
bad.
with my legs. It's
Most
just
of the problem was the back pain.
with the back.
How's the back pain now?
And huh?
How's the back pain now?
Now, since surgery, my back's been great.
Yeah,
I haven't had any problems with it.
but the surgery had
But the
one of the
surgery-
side effects that we talked about before.
And I ended up having drop foot.
Can you show me this foot?
And
Yeah. Now
this I
this,
can move now. Originally, I couldn't move it at all.
yeah,
There is
right
no
after the
movement.
surgery, you could barely move it at all.
Yeah.
And then every few months, we actually checked you out, and I noticed it's getting significantly stronger now. This is what we call 4 of 5 now. It used to be like barely you could even move
Yeah,
it.
I couldn't move it at all.
Yeah. So can you tell me about, first of all, how long did it take, or how did it, what time period do you think it's starting getting better?
Oh, probably 5-6 months.
Yeah.
I mean, it was so gradual at first, you wouldn't notice anything because my foot would stub and I'd trip.
Yeah,
I'd pay
yeah,
attention.
yeah.
And I'd say in the last month, it's gotten a lot better.
A lot better. And that is what as well I tell to all my patients, that the improvement is so slow. Most of people can't even tell when it starts getting better.
No, you don't, because it's all of a sudden you'll start to notice that you're not looking down at your foot all the time.
Yeah, and it's working. It start working again.
Yeah.
So we are only about 9-10 months out. In the next 6 months to a year, still will get better. And the reason it grows and it improves so slowly is that the nerves in our spine, they grow as fast as your hair in your head, about an inch a month.
Okay.
So meaning that nerve to grow back all the way from your spine down to practically your foot, and the muscle that control your foot, that can take a good part of a year sometimes.
Yeah. And, I mean, it's getting there, and I didn't have a lot of movement to start but it's drastically better.
Excellent. Now, one of the things as well, but some of my patients are telling me that before it starts getting better, they have that like zapping, like a jolt going down to the foot. You told me you didn't have much of that, which is good for you.
Yeah, I didn't have any jolting or nothing. It just makes it uncomfortable for sleeping. Which now it's getting better. I can get 4 hours of sleep.
Yeah, and how's the feeling in top of the foot? How is that?
It's just kind of like a numbness.
A little numbness
Yeah.
still.
I move my toes. It's just a numbness. I mean, it's not a sharp pain or anything.
Yeah.
It's just you realize it's there and you got to lift down because you hear it clapping when you're walking.
Yeah.
But
Was the surgery worth it?
definitely.
Okay. So even though you had that complication,
The one
and
trade-off, but I can move and I can sit, and I'm not uncomfortable in my back and everything.
yeah, and I hear that a lot. They say, every time of the day I'm happy to trade not having pain and having like numbness there, or even foot drop, as long as I don't have the pain. But the good news for you is you're not done. This is still going to get better.
Well, that's a good thing.
Yeah, that's a good thing. So we are not done. This is not the end of the story. Anything else? Any other comment and so on? And you talked about that you have to be careful, you have to watch, and we train people. We do physical therapy. Are you still doing those exercises?
I'm doing my own now. I
Good.
I did the therapy, and the therapist gave me exercises to do with rubber bands stuff and stretching
Okay.
3 times a day, and
Okay.
I try to do it 3-4 times
Well,
a day.
what I want to emphasize that even though our surgery is one of the risk of our surgery is what we just described, the open surgery and traditional surgery has the same risk, in our study actually higher. So this is not specific to our surgery. Any kind of time you work around the nerve, that there is a risk for that. Our surgery in our study that we saw that only 1% in 303 patients had still meaningful symptoms after a year. In your case, it's not even a year. But open surgery has that risk. Actually, ours was 0.3%. In open surgery, is somewhere between 1 and 3%. So even that risk is higher in open surgery. But as well, we have that risk and we disclose it to our patient. Do you remember us talking about that before the surgery?
Yeah.
What do you remember? What did I tell you?
I know it was 1-3. I think it was like you said 50% chance.
15%, 15% temporarily, but then obviously there's always smaller risk of having longer deficit of that. But I'm very happy actually what I see. Bone is beautifully growing, and I'm looking forward next time I see you telling me everything is back to normal. Okay.
That'd be nice.
Yes.
I mean, it's way better now
Excellent.
than it was.
But you have to work on it. You have to keep working on it. Okay. Well, thank you so much for this interview. I really appreciate that.
All right,
Okay.
thank you.